The Basic Healthcare Provision Fund, BHCPF, is designed to be a sustainable model for equity and financial risk protection for vulnerable population by guaranteeing access to basic minimum package of health services. Correspondent Fortunate also examines the impact of the Basic Healthcare Provision Fund in some local government areas of Ebonyi State. The report.
A tour to most health facilities in Ebonyi State reveal that the impact of the Basic Healthcare Provision Fund is heartwarming in some areas, while in most areas like human resources, infrastructure in the health facilities, and in other areas like toilet facilities, the performance of the BHCPF is abysmally low. And this calls for concern and serious action to ensure that we do not pay lip service to healthcare delivery in the nation. Join me as we look at some of the facilities and situation in some of these health facilities across Ebonyi State, Nigeria. The Basic Healthcare Provision Fund was enacted under the National Health Act 2014, which stipulates that 1% of the consolidated revenue of the Federation should be dedicated to health, with the specific objective of establishing at least one fully functional public or private primary health care center in each political ward to achieve universal health coverage. The implementation of Basic Healthcare Provision Fund started in Ebonyi State in the year 2020, with the state government paying the initial 25% counterpart fund of 100 million naira that enabled the state to access the direct facility funding DFF in 2 tranches in 2020, as well as 1 and 2 tranches in 2021 and 2022 respectively. However, the state is yet to pay another counterpart fund since then.
Though the state government tried by paying the initial fund to make sure that both the agencies stand and also we benefit from the Basic Health Provision Fund. So since after then, we have not been able to receive second counterpart fund, though we have been writing and also soliciting, making advocacies to make sure that the state pays, because if this counterpart fund is paid, it will help us, most especially making sure that supervision is up to date, because supervision of the activities is very important. So, and apart from that supervision, the office setup, the office and logistics must be taken care of. So those things are what we are grappling. And again, issue of the human resource for health, at least getting the ad hoc ones. If it can assist us, if the money is paid, assist us to make sure that we augment the ones that come from the national.
At MCH Okposimoara in Ezza North Council area, selected under the fund, women, children, and patients of all ages were in their numbers. The office has plywood partition. The facility has only 1 toilet, which is in a bad condition, serving both the staff and patients. The facility is in dire need of office expansion and professional health workers. Nweke LOG Health Facility in Ezza North Council area is almost moribund, with some wooden beds, and has no electricity, water, and other basic equipment. The officer in charge of the facility, Mrs. Regina Ezza, is a nurse midwife and the only staff present when NTA News visited. She says the dilapidation is because residents prefer visiting selected health facilities where they enjoy free services.
We have LGA team, comprises 3 persons, the AS, the MIE, and 1 other person. But we are handicapped. We are just struggling to manage and visit and see what they are doing. Not that we are carrying out supervision as it's supposed to be frank, because we don't have the resources. We don't have the resources. For you to visit one health facility, you will definitely spend at least 3,000 naira. and it's just out of your pocket.
The primary health care center, Ibego, in Izzi Council area, has 5 functional toilets. The facility does not have drug shelves and water. It has only few beds with 1 mattress on the floor of the male ward, while only 2 volunteer nurses are assisting the community health extension worker, Mrs. Monica Ona, who is in charge of the facility.
We prepare what we call business plan. After the preparation, we will show it to our AS at the LGA. He will vet it and approve it before sending it to a ministry, to primary health care agency, where they will look at it very well and approve it. After the approval, they will approve the money. When they approve the money with the WDC chairman and the WDC committee, we all sit down. Before preparing the business plan, we all sit down and know the real need of the facility, the major challenge that we're about to face, and that particular.
Yes, like since I begin to come here, I haven't had anything like regret. Like since I begin to go hospital, I can say that this is the best place I have seen. It's just somebody directed me, and since then I am happy. I'm glad the way they attend to me, the way they address me. They don't neglect and they don't change much. That is why I'm here.
BHC Ebonyi in Izzi Council area, on the other hand, has no toilets except one still under construction. The facility has no water and depends on the rain. The beds are few and the wards unconducive. The PHC also has a lab technician, a community health officer, 3 volunteers, and interning students.
It's hard. It's the basic health care that made us demarcate everything, even drugs, seeds, this tank, and the toilet and bathroom, which is still in progress. Even we built placenta pits recently.
All the selected facilities was the highest they will have in our own selected facility. 2, and they are choose. We don't have nurses. That just as what you have said, that the nurses midwife they employed as an ad hoc, they ran away because of a non-payment of their allowance. So we are feeling it. It's too much like this place now. If this one will go just to rest, nobody will help her.
One of the challenges discovered in the course of this investigation is the unwillingness of some rural dwellers to enroll and access medical care in nearby health centers. NTA News witnessed a sad incident of a 12-year-old child who was rushed to Onicha BHC Egonwo Ezukwa ward and died few hours later. His parents had been self-medicating the boy only to rush him to the hospital at the dying moment, and it was too late. The officer in charge of the PHC, Ezza, who is a community health extension worker, lamented that the roof of the facility leaks water. The facility has 1 general ward with 1 side closed off with plywood to make for a delivery room. It has no water and toilet, while some rooms have no windows and doors.
Our challenge is now is all our windows, they are just water out. And the bed, even the ward, we don't have enough accommodation. The only that hall. Then I use this plywood and demarcate it in case any woman for any woman deliver. If not that bond, it is open, even male and female, everybody can. Then I use that thing and demarcate it.
Oshiri PHC Nwodogbo Ebia Ward in Onicha Council area is an old facility with parts of the building almost dilapidated and not in use. The facility has 6 toilets with broken septic tanks. Amas MDG's Umudomi Ward, Onicha Council area, on the other hand, has 2 functional toilets for patients and staff, although the patients prefer open defecation. It has a functional borehole, but its solar-powered fridge is not functional as at the time of filing this report because the money to fix it is not available.
My coaching system has a fault. It has been spoiled. So for immunization, I used to go outside here to get ice pack and my vaccines before I can give immunization. If government can help me to provide solar fridge and the solar light, because it is not working again. It has been working, but now it's not.
The basic health care provisional fund, it is very, very important and very, very helpful to the health delivery system in Onicha in particular, and as well as other local governments. So in the first place, some of the structures that have been dilapidated situation, most of them are gradually coming to the normal shape.
Amangu PHC in Afikpo South Council area is domiciled in an old structure with parts of the buildings in deplorable condition. The PHC has no placenta pit, no toilet and bathrooms. However, the PHC has one lab technician, a community health extension worker, Mrs. Ugwoma Inya Okoro, who is in charge of the facility, and 2 volunteers who are paid from the salary of the officer in charge.
For the EPSHA, that's 67,000 they give, and it has not been constant.
They gave you 67,000?
Maybe for 3 or 4 months. Per month, it's not so much, and that has been good. It's not steady. It's not coming steady, okay. And that has been going on drugs.
Okay, does it come quarterly or every month?
Formerly it was a monthly, but now they pay either twice or quarterly.
Okay, so and that is 660. You said
67,000.
60 to 70,000.
Yes, every month.
Owutu PHC has no functional toilets and depends on the rain for water. The facility, which has a community health extension worker, Mrs. Esther Uwezuke, who is in charge, and 4 permanent staff, 1 lab technician, 1 junior CHU, 2 cemetery and sanitary keepers, as well as 3 volunteers, also lacks drip stand, sufficient beds and mattresses.
If they can help us to maybe give us one borehole to be okay, and also help us. And the fence, all the fence have fallen off. So if they can help us to renovate it, it will be good. Because if we lock the gate in the night, we'll be having a lot of stress from the fence because we have people that are living here.
The major challenge facing MCH Ekaba Azuyu Dene urban ward in Abakaliki council area include being in the middle of Ekaba market and sharing space and toilet with the market. The facility needs to be fenced and separated from the market. In the same vein, the facility needs more structures as it currently operates in a 2-room structure and 1 adjoining room. It has no water supply.
We need to have standard postnatal ward. As it stands now, this is the only ward that I have. A patient is staying there. Whenever I deliver, a postnatal woman that is not supposed to be here with other patients is also here. You can see my challenge. So if possible, I need more rooms, like at least if not 4 or 5, to have that my delivery was standard. I have 2 rooms for delivery and consulting and a waiting room. That is what I have there. But just small room like that, not a standard one. Some people will come around. I will now say, let me orientate you. They say, Mommy, this place is fine, but this your room now. You understand such a thing? It's already discouraging the person to come to deliver. So after managing ANC person, you see her going another place because of that. Just few person used to deliver
so
here.
We thank the federal government. We are using it judiciously. You can see the nurses, the people that are here waiting for patients to come. And it's government that is paying them, and they are doing their work. Had it been you came in here and you didn't see any of them, I thought you will feel embarrassed. But you can see them, they are doing their job. in their normal time.
MCH Azuyokwo in Abakaliki Council area is an example of a typical PHC with a large expanse of land and state-of-the-art buildings with functional toilets for patients and staff. The staff who keeps the keys to the toilet was not on ground and we could not assess its cleanliness. The facility, which competes with some secondary and tertiary health institutions in the state, has a nurse midwife in charge, 6 community extension workers, 2 nurses, a visiting doctor, and many students on industrial training. It has a habitable on-site residence for health workers. Others include a lab technician with a functional laboratory, as well as virtually everything a standard PHC needs.
It is really actualized in our facility. And as you can see, majority of the women that are coming here, they are enjoying it. And that is why in a primary health care, you will be talking of between 80 to 120 delivery per month. The basic health care provision fund is part of our success here.
Responding to the challenges faced by PHCs in the council areas visited, the Executive Secretary, Primary Health Care Development Agency, Ebonyi State, Dr. Mrs. Catherine Barry Oko, expressed optimism that the ad hoc staff in most PHCs will be absorbed as permanent staff when approval is given by the National Primary Health Care Development Authority, adding that the agency disburses funds to all health facilities as and when due.
What they're doing now is setting up of solar lights in the facility, which help them for the solar fridge and every other thing for the facility to have light as far as the sunshine is on. So this is actually what they're doing with the money now. And then we are waiting for another tranche that will soon be paid to them. And before, as I said, before they do anything with the money, they will prepare this business plan. Then we go through it, discuss it.
Dr. Daniel Umezurike is the Commissioner for Health, Ebonyi State. He agrees that volunteers are recognized in primary health care and the ministry, provided they have the basic minimum experience to function. He assured that the state government will pay the remaining counterpart funds to ensure continuity of the program.
With our governor, we don't ever take last. So because this project was implemented from 2021 and 2022 now. So and in 2021, the state government was able to pay the counterpart fund. And this year has not ended, so we still do that. And the salaries of the workers is also a responsibility of the state. So when you check all these things and all the interventions that we have done, you see that we are not even talking about the counterpart funding. We have surpassed that.
The Executive Secretary, Ebonyi State Health Insurance Agency, LGA, Dr. Mrs. Uzoma Agu, said the agency can assist health facilities by sending doctors to them periodically, adding that the health facilities are capable of paying volunteers with the capitation they receive. It is pertinent that all hands should be on deck by relevant authorities to revamp the primary health care facilities in Ebonyi State to ensure that the objective of the Basic Health Care Provision Fund is fully utilized. In Abakaliki, Fortunate Ozo, NTA News. This report is brought to you with support from the International Budget Partnership, IBP, and the International Center for Investigative Reporting, ICIR.